So there's been an outbreak of pediatric pneumonia reported in parts of the country. They call it white lung syndrome, and it's, again, been spreading in parts of the United States. Some parents now wondering whether the cases might be at all linked to this surge of apparently similar respiratory cases that have been reported in China. So context on all of this, Dr. Amesh Adalja joins us, a senior scholar at Johns Hopkins, at the Johns Hopkins Center for Health Security. It's good to see you again. And let me start and try to do this in order, because anytime you do a story like this, the headline sometimes can grab people and they'll be saying, oh, what's going on here? First of all, in Ohio, there are 142 cases reported in Ohio of this so-called white lung syndrome. I've seen some comments out of the CDC to say that overall in the country, the pneumonia cases really aren't that much different than we would see in a normal year. So what is going on here if you had to put it in context?
Well, what we know is that there's one county in Ohio, Warren County particularly, that has higher than their average number of pneumonia cases. And even if you look at the whole state of Ohio, they're at their baseline. So there's not anything going on in the state as such, but this county seems to have an increase. And it's caused by a variety of different pathogens, things that are known, like adenoviruses, like COVID, like flu, like RSV, and a bacteria called mycoplasma. So all of those things seem to be conglomerating together and causing this cluster with known pathogens, which is what makes it somewhat easier to handle.
So Massachusetts is also reporting something of an uptick, I believe. You're not seeing it in a bunch of other places yet. Again, to go back to the original point, how is any of this out of the ordinary for what would be considered a quote-unquote normal year?
It doesn't appear to be out of the ordinary. We know, for example, last year we did have an out of the ordinary respiratory virus season when hospitals were inundated with RSV, flu, and COVID, all three at the same time, because of some increase in susceptibility that occurred in the pediatric population because of all that social distancing. And that may be what's going on to some extent, but some of these have cycles. Some of these pathogens have cycles, and we may be in an upswing, for example, with mycoplasma pneumonia. And it doesn't necessarily seem to be something to alarm anybody about. It's important that pediatric hospitals are well resourced, because we know that pediatric hospitals, for example, don't have the same types of resources that an adult hospital has, and they can get hit with capacity concerns quicker. But this doesn't seem to be anything out of the ordinary, but it bears watching and tracking to see what happens in the days to come.
Now, what's happening in China? Because then we have the reports of all these respiratory illnesses in hospitals in China. Now, their shutdown for COVID was much longer. I'm, hearing from some experts like yourself, maybe that affected how they came out of it and they're getting a different cycle than the other parts of the world. What's happening in China, and is there any link between what's happening there and the conversation we're having about, Ohio and other places?
First off, I don't think there's any link between Ohio, Massachusetts, and China. Right. What I think is happening in China has to do with the same thing that happened last year in the United States and Canada, where all of these respiratory viruses, respiratory pathogens that were kind of on hiatus because children weren't socially interacting, all came back. And now there was basically 3 cohorts of children who had been born during the pandemic that served as susceptible hosts. And they all got sick at once instead of over 3 years. And that crushed some pediatric hospitals. It seems to be that's what's going on in China as well, that this is just off a year because they stayed in a very strict lockdown for a year more than most other countries did. And based on what the WHO is saying, and they've been pretty forceful with the Chinese government on being transparent here, it does appear that these are all normal pathogens that we would expect to see in a respiratory virus season going kind of in full swing post-COVID.
Now, you may have seen some politicians, Senator Marco Rubio, I think is one of them, calling for travel restrictions in and out of China. Is that something that's needed or makes sense from a medical perspective when you hear about that? We're looking on the letter that some of these senators sent to President Biden on this topic on the screen right now. Does any of that seem necessary to you?
No, travel restrictions are never necessary, and they're especially never necessary with the respiratory disease, because by the time you even put travel restrictions in place, it's already gone. But there's no need for that with what's going on in China. And even if there were a need for something like that, or this was something concerning, travel restrictions wouldn't work either. Travel restrictions are a tool that politicians turn to, both Democrats and Republicans, but it never actually is something that is justified based on the infectious disease epidemiology.
So your point is, even in the early days of COVID, for example, it was way too late. I mean, by the time those restrictions were put in place, right? That's what you're saying?
Exactly, because we know, for example, when they were quarantining people on Air Force bases in California, that virus was spreading on both sides of that fence in the United States. So that was basically political window dressing to make politicians feel good that they were doing something, but it didn't actually change the trajectory of anything. And that happened during the Trump administration. It also happened during the Biden administration when he slapped travel restrictions on Southern African countries over the Omicron variant, which were basically futile and just political, just kind of political capital that he was using at that point, but not something that was justified by infectious disease epidemiology.
All right. As always, balanced approach, and it comes from expertise. So, like you say, we'll watch this, and we'll see what happens in places like Ohio and other places. But Dr. Amesh Adalja from Johns Hopkins, thank you, sir. Good to see you, and thank you for coming on today. Thanks so much for watching. Just go to joinnn.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.